When it comes to heart attacks, it's not one size fits all. Not everyone has chest pain or an abnormal heartbeat when they're having one.
Some may just be dizzy or even have some stomach pain. CBS 21's Larry Greenberg explains why women may be more prone to these symptoms and why it may not just be your average heart attack.
Sometimes a heart attack is not just a heart attack, but a random tear in the coronary artery wall. It doesn't look or feel like a heart attack, but the blood stops flowing just the same, and it can be just as serious.
The following segment is sponsored by Geisinger Holy Spirit.
When it comes to matters of the heart, things are always a little different for men and women.
Women usually have additional symptoms that are sometimes underdiagnosed or, kind of brushed away because we think of them as something else.
Typically, a heart attack is caused by a stop in blood flow due to a blockage or blood clot in the coronary artery. But there can also be a spontaneous coronary artery dissection, or SCAD.
The heart arteries have 3 layers and they have muscle in them. And so the layers of the muscle actually split in the artery.
Dr. Sharma says that splitting or tear forms a hematoma or swelling filled with blood that affects regular blood flow in the artery. He says all this happens suddenly in a matter of seconds. It's not caused by typical plaque buildup that we associate with heart attacks. And for whatever reason,
80% of cases are in women. It occurs, they think there's a hormone imbalance. We don't completely understand this disease process.
The theory behind its association with hormonal balance is because it often happens in women during childbirth or their menstrual cycle. Doctors say if you think this may be happening to you, call 911. They'll likely treat for the attack and diagnose the SCAD later.
This is clinically indistinguishable from the traditional types of heart attacks that people have.
Dr. Sharma says because it's so hard to see, it's often not until the doctor takes you into the cath lab that they're able to figure out what exactly happened. He says there's really no way to prevent a SCAD other than the typical lifestyle choices like diet, exercise, and not smoking. With this week's Doc Talk, I'm Lara Greenberg, CBS 21 News.